Telehealth was supposed to be the ultimate efficiency engine for modern medical practices. But while the patient experience became frictionless, the staff behind the screen were quietly buried under mountains of invisible administrative work. In just 6 years, the portion of physicians using telehealth on a weekly basis nearly tripled, rocketing from 25% to over 71%. We are looking at a $42 billion market. Projections indicate that by 2026, up to 30% of all medical visits in the United States will take place virtually. The clinical interactions successfully moved to the cloud, but the heavy operational tail of that visit, the scheduling, the documentation, the EHR entry, and the patient follow-ups remained anchored in the physical office, and almost nobody budgeted the time for it. This chart illustrates the core operational problem. As telemedicine use scales up, total physician time spent on electronic health records jumps to nearly 11 hours for every 8 hours of scheduled patient care. That is a 3-hour increase tied directly to digital visits. If we zoom out to look at an average 57.8-hour physician workweek, the imbalance becomes obvious. Only 27.2 of those hours actually go to direct patient care. The dominant share is completely swallowed by documentation and administrative tasks. The pressure trickles down instantly. In mid-size practices, support staff are currently losing 8 to 12 hours a week strictly to manage telehealth workflows. Because the documentation requirements do not stop when the video feed cuts out, virtual appointments force this backlog into the evenings, creating a severe after-hours effect. The technology failed to eliminate administrative labor. It simply displaced it into the off hours of an already exhausted workforce, establishing a permanent structural deficit within the practice. Practices often try to solve this by repurposing their existing front desk coordinators, asking them to juggle physical waiting rooms alongside digital appointment queues. This strategy triggers a predictable staffing spiral. The inherited digital volume leads to chronic overwork. Overwork accelerates burnout, and burnout ultimately forces your staff to quit. Losing a single team member carries a massive financial penalty, with the average turnover cost for a registered nurse hitting over $61,000. Replacing them is even harder. The national healthcare sector is facing 1.9 million annual job vacancies, making it nearly impossible to recruit into roles that are already structurally broken. Trying to run a modern telehealth program by stretching your in-house team guarantees operational friction and serious financial loss. The solution requires a different approach entirely: structural decoupling. This is the deliberate operational strategy of separating clinical patient care from digital administrative tasks. Instead of forcing an in-person receptionist to split their attention, a decoupled model relies on dedicated off-site specialists. Their sole focus is scheduling, entering EHR data, and handling virtual visit patient communications. To execute this without creating manual data transfer errors, this remote administrative layer must be built with deep native integration directly into the practice's existing electronic health record system. Smart practices are achieving this by outsourcing the work to services like Staffingly, deploying virtual medical assistants who operate during standard U.S. business hours rather than trying to expand local headcount. Structural decoupling ends the staffing spiral by lifting the invisible weight of digital administration and removing it from the physical office entirely. These dedicated remote teams also use AI-powered force multipliers. Document intelligence and automated error prevention tools allow them to process paperwork rapidly, accelerating these workflows without removing human oversight. In a side-by-side financial comparison, hiring a fully loaded U.S. in-house employee costs $60,800 annually. A dedicated virtual specialist performs the exact same function for $21,600. This gap represents a 64% cost reduction, translating to over $39,000 in annual savings per position. The implementation timeline for this model is incredibly fast. Practices can deploy a fully trained, HIPAA-compliant virtual assistant team operating securely inside their EHR in just 48 to 72 hours. This transition comes with built-in risk mitigation. There are no long-term contracts. You start with a 2-week pilot and operate under a 30-day performance guarantee to ensure the workflow functions flawlessly. To survive the permanent integration of telemedicine, medical practices must abandon legacy in-house staffing structures. Adopting a dedicated, decoupled virtual support model is the only mathematically sound way to protect your team and your margins.